Dear audience and dear chair, welcome everyone on the 6 months progress report, where I would like to present my PhD thesis, Innovative Multimodal Imaging Techniques in Dermatology. My name is Noémi Varga. I'm a medical doctor and a PhD student at the Department of Dermatology, Semmelweis University, and my supervisors are Norbert Kiss and Márta Medvec. Our vision is to improve the survival of skin tumor patients, and to achieve our vision, our mission is to promote the implementation of novel imaging techniques in clinical practice. We have 2 ongoing projects. Both of them are systematic review and meta-analysis. The first project is comparing the efficacy of imaging modalities for the diagnosis of malignant melanoma. Malignant melanoma is a melanocytic tumor that is responsible for most of the skin cancer-related death, with an estimated death rate of nearly 8,000 people every year. The reason for low survival rate is delayed therapy, and that's why early diagnosis is crucial for melanoma patients. So there's an unmet need to find new non-invasive diagnostic techniques. Dermoscopy is the currently used non-invasive method for melanoma diagnosis. However, it has several drawbacks. For example, it is examiner dependent and it has limited diagnostic reliability. Novel non-invasive optical diagnostic techniques use the special properties of photon and light to obtain more detailed images of the skin and to get additional objective information. Therefore, we aim to compare the diagnostic accuracy of non-invasive optical diagnostic techniques for the detection of malignant melanoma. Our clinical question is, which is the most accurate non-invasive optical diagnostic tool for the detection of malignant melanoma? For this, we use the paired framework, where the population is patients with suspected melanoma, and the index tests are non-invasive optical diagnostic techniques. The reference standard is histology, and the diagnosis of interest is malignant melanoma. We plan to compare the index tests with the histology, and we also plan to compare these non-invasive optical diagnostic techniques indirectly with each other as well. Our hypothesis is that novel non-invasive optical diagnostic techniques have better diagnostic accuracy than conventional dermoscopy. We conducted our systematic search on the 15th of November, and here you can see our final search key, which has 3 domains. Here you can see the flowchart of selection. We started with more than 16,000 articles, and after the selection, we had 172 eligible full texts. Here you can see the outcome parameters. We used the diagnostic accuracy metrics like sensitivity, specificity, positive predictive value, and negative predictive value. And we finished the analysis of optical coherence tomography and multispectral imaging. And we have several ongoing analysis on the several non-invasive diagnostic techniques. Here is the forest plot on the diagnostic accuracy of the optical coherence tomography and the multispectral imaging subgroups. The forest plot depicts the sensitivity and specificity of these non-invasive optical diagnostic techniques. Sensitivity and specificity are vital for diagnostic test accuracy. Sensitivity is the true positive rate. It refers to the test's ability to designate an individual with a disease as positive. And the specificity is the true negative rate. It refers to the test's ability to designate an individual without a disease as negative. We have 3 studies, including 210 patients for the OCT, and 12 studies involving 2,900 patients for multispectral imaging were analyzed. The studies were mainly prospective clinical trials. Both of the imaging methods show statistically significant heterogeneity attributed to the device, different technical parameters, and different settings. As you can see, the pooled average sensitivity for OCT is 86% and the specificity is 87%, which means that out of 100 positive patients, the OCT can correctly classify 86 positive patients and misclassify 14 patients as negative. And similarly, multispectral imaging, the sensitivity became 92% and the specificity became 52%, which means out of 100 positive patients, the multispectral imaging can correctly classify 92 patients as a melanoma and incorrectly classify 8 patients. Clinically, both methods can be used as screening tools. However, their low specificity suggests that limitations are in correctly ruling out benign pigmented lesions, and therefore it can lead to several unnecessary excisions. So therefore, they are best utilized as supplementary screening methods, but not standalone diagnostic tools. The large sample size and the comprehensive analysis of the non-invasive optical imaging methods for the diagnosis of melanoma are the strengths of this project, and the heterogeneity in the study types and differences in the testing strategy limited the systematic comparison of these non-invasive diagnostic techniques. Based on our preliminary results, the high sensitivity for OCT and multispectral imaging can be helpful for screening patients with melanoma, and it has several practical and research implications. For example, these novel non-invasive optical diagnostic techniques can be used as an alternative to the conventional thermoscopy. Here you can see the progress of our first project. We are at the data extraction phase, and we would like to finalize it until the end of March. And our second project is comparing the diagnostic accuracy of imaging techniques for assessing Breslow thickness in malignant melanoma. As I mentioned previously, melanoma is a very dangerous tumor, and early diagnosis and treatment can lead to a better survival for melanoma patients, and therefore early staging is a crucial point of melanoma care. The stage of the melanoma is primarily established based on the Breslow tumor thickness. However, it is unavailable at the initial clinical diagnosis. Accurate preoperative prediction of Breslow thickness can lead to the exact surgical margin and can also say the need for sentinel lymph node biopsy at the same time as premier surgery, and it also sets out further imaging procedures such as PET-CT and MRI. Therefore, our aim was to compare the diagnostic accuracy of non-invasive diagnostic techniques for the preoperative prediction of Breslow thickness in malignant melanoma. Our clinical question in this case was, which is the most accurate non-invasive diagnostic tool for this task? And here we also used the paired framework. It is actually the same as previously, and with exception the diagnosis of interest, it's the overall diagnosis of Breslow thickness. Our hypothesis is the diagnostic accuracy of non-invasive diagnostic techniques is non-inferior to the histological evaluation in the preoperative determination of Breslow thickness. The clinical implication of this project, if we can accurately predict the Breslow thickness, it can lead to a faster staging procedure and it can speed up the therapy, so it can increase the survival of melanoma patients. Our second project seemed to be feasible, and we plan to submit both of our projects this year. I would like to say goodbye with the quote of J.K. Rowling. It is important to remember that we all have magic inside of us. Thank you for your attention.
Congratulations. I wanted to ask you if apart from OCT and confocal, you found articles about the skin ultrasound in the diagnosis of melanoma?
Thank you for your question. Actually, ultrasound is not an optical imaging device, and we included only optical imaging device in this study, but it's a very good site because there are skin imaging ultrasounds. So, but we didn't include that because we only wanted to include optical imaging device.
Okay,
Thank you.
Congratulations for your wonderful presentation. I have a question regarding about your first topic. What sensitivity and specificity values expect from other imaging modalities, and what will be, according to your opinion, the most accurate?
Thank you for your attention. So we expect to be, the RCT will be, So we expect that reflectance confocal microscopy will have the highest sensitivity and specificity results out of all these optical imaging techniques. And after that, there will be optical spectroscopic device, and after that will be only the OCT and multispectral imaging. And we expect from dermoscopy that it will range on in a very wide scale, from a very low and a very high sensitivity and specificity results.
Thank you.
Congratulations to your really great presentation. It was really nice. And I would like to ask that I saw in your outcome slides, in the ongoing analysis, that there's artificial intelligence. And how would you like to analyze that, or what's that for?
Yeah, thank you for your question. It's a very good question, because we consider that artificial intelligence would be an outlier beside the other optical imaging techniques, because we expect that it will have very high sensitivity and specificity results. So we plan to make a subgroup analysis of this of the artificial intelligence results, and yeah.
Thank you very much.